Hello and welcome to Midreach Technologies. In this video, I'll be showing you how MidHealth can make managing patient records smarter, faster, and more secure. Whether you are running a small clinic or a large hospital, this user-friendly software, EHR, is designed to simplify your workflow and save you time. Let's take a quick look at how it works in real life. Alright, so this is the login interface of the software. If the software is installed in your clinic or facility, this is going to be the login interface, and every staff of the clinic or hospital will be provided with a username and password so that we can track all the activities of every user. That's the reason for creating the username and password, and every user has his limitations in the software. So we design privileges in the software. So every user will have a privilege to use the software. There are some certain places that you may not have access to because of the privileges. So I'm going to use my normal login and password. Alright, so once I put the username and password, I'll log in and it will detect my username and password. Sorry, I mistakenly put the wrong password. Alright, so this is the dashboard of the software. We have the side menu here. This is the side menu where we have all the departments of every hospital. As I've told you earlier, every department of a hospital is covered in this software. It's captured. Yeah. So maybe from the pharmacy, outpatient, inpatient, laboratory, radiology, every department, NHS is also included in there. So this is just the dashboard of the software. So maybe the first line of action of a patient, maybe when a patient comes to a hospital, the first thing that he needs to do is for him to go to the medical records. That's the first point that the patient usually goes. So when he goes to the medical records, that's why they will capture his details. They will take his full name, address, phone number, and everything. And once they took that, they will write it down and process it to the nurses. So that's exactly what we did here. We automate that process. We create registration pages where every patient will be registered, and the software will automatically provide a number for that patient. That's the hospital number. We call it an EHR number. So the software will create the EHR number for that patient, and it will be unique. The patient number will not be given to any other patient. Once a number is being given to one patient, it cannot be repeated again to another patient. So that's how the software works. So we have now, it recognizes that I'm the one that logs in here. So we have the medical record here. Once a patient comes, the medical record will ask him if he is registered already, if he has an EHR number, a hospital number with them. If he has the hospital number, then they will take the hospital number and go here on that under medical record. They will see follow up here. That's why they will go and put the EHR number there. And if the patient is not registered, it's a new patient, they will come here under add new patient. They will click here and register that patient. It will bring out a form. It will bring out a form for the patient, and they will register the patient. So we have the form here. We have the full name, we have the phone number, we have the date of birth. The date of birth, you can select the date directly, or you can just put the age of the patient. Some patients didn't know their date of birth. That's the local patients we have here. Most of them didn't know the exact date of birth. So what you can do, you can just ask them of their age, and once you put the age, you come here, you click how old are you, then you put the age of that patient. If the patient says maybe he's 35 or 25 or 28, once you put 28 and click OK, it will provide the date of birth, exact date of birth of that patient using the exact data we are in. So it will give you the date of birth of that patient. So we have the gender. You select the gender of the patient, male or female. Then you put the address. You put every details of the patient that is needed. Once you do that, once you put the patient, let me just quickly rush. All right. So once you do that, if the patient is referred, you click on referral. Referred in. If it's not referred, you leave it like this. If the patient may be brought in as a police case, you select if it is a physical assault or sexual assault, you select it here. If it is none, you click non-police case, then you put the details of the police officer that brought them. All right. So that's how the registration form is. And what we have here is the software is open to changes. Maybe if you have some things that you want us to add into the software, you can just give us and we'll add it. We can add it in the form or in the software. So that's how the software is. Because we created the software from the grassroots, so that's why we can always maneuver the software and create it to our tastes. So we have the regular patient, that's a normal patient that will just come in, make payments of everything and go out. Then we have retainership patients that maybe deposit, maybe a family card, maybe they create a family card whereby they will be depositing money in that family card, and every patient maybe under that family will be registered under that family. So whatever charge is going to be, the charge is going to be under that family, and at time being all the deductions that are going to be done will be under that family. All right, so that's the retainership. Once you click, you will see the list of all the retainership here. So this is the regular patient, not a retainership patient, so we click on regular. All right, and there is a place you can add all the retainerships and everything. So for now we are registering a regular patient, so you click on register. Once you click on register, the patient will be registered in the software. The registration is done. It will give you the patient can be captured, the image of the patient can be captured from here, and once the user click on this button to capture the patient image and save. So from here it will give the patient an EHR number. So whenever the patient comes to the hospital, this number you present this number, and all his previous history can be fetched using this EHR number. So the next thing is for the patient to go to the medical record and make the payment, the cashier, and make the payment of his visit for either the registration or the subsequent visit that he's come for. So now, now the nurses will be able to see the patient that is sent from the medical record. So when they come under outpatient, they'll click on vitals. That's why they will see all the patients that are sent from the medical records for consultation. So this patient is the only patient that is sent from the medical records now, and we can see here the patient has not paid his consultation fee, so he's supposed to go to the cash office and make the payment. And if the patient is a retainership patient, it will automatically deduct the money from the family card and activate the patient for the next action. So this patient is a regular patient, so he doesn't have a wallet or a family card, so he needs to go to the cashier and make payment. This is the interface of cash office. This is where they will be making all the payments for all the patients. So they will click here and they will put the EHR number of the patient. This patient is provided with an EHR number. This is the number, and we are going to put it here 448. So once you put the number here and search the patient, we will see the consultation payment that is sent from the medical record. This is the payment. So we'll click here and make payment. We can select the payment type, either cash, POS, or transfer. So we click any of the payments. Once we click it, it will automatically activate the patient that he has paid the registration fee. So once this registration fee has been paid, if he comes back to the nurses, they will see that the patient has paid his consultation fee, and the bottom will appear here that they need to put the vital sign of the patient, and they can send him to the medical doctor for consultation. So they will click on the vital signs, they will put all the vital signs of that patient. They'll put the blood pressure, the temperature, and everything. So they are going to put it 100/50, and the SI unit is already captured in the software automatically. So we'll put the temperature, let's say 45 degrees. We'll put the 45 below, and then we'll put the weight 100, maybe, or 80 kilogram. Then they put the height and every SO2 respiration and everything. So these are the only things that maybe we need. If there's any additional things that you want, we can add it in the software. So this is it. Then they will click on update. They will select the room of the medical doctor, then they click on update. So the patient will be sent to the medical doctor. Now we have no patient on diagnosis because we have patient with the current patient. So now it's up to the doctor to come under our patient, and he click on open clinic, and then he can select his clinic. We have GOPD and NHS for now. We can add, it's open, there's room for additional clinics. Every hospital can add its clinics that it has. So we can add multiple. For now we have GOPD and NHS, so we are going to use GOPD because that's why we sent the patient. So we are going to log into the room 1, and we will see the patient here waiting for doctor to attend to him. So when a doctor click on attend patient, it will bring out the information of the patient with the vital signs that are sent from the nurses. These are the vital signs that are sent from the nurses. We have the blood pressure, we have the temperature, we have the weight, height, pulse, SpO2, and everything. So these are the buttons that the doctor needs to use to document all the clinical activities, to admit the patient, to send investigation, to prescribe drugs for the patient. Everything that is needed to be done for the patient. This is why he's supposed to do it, and you can see the previous history of that patient if there is any under the clinic notes. If he comes down here, you will see the previous activities that are done for the patient, and we have the admission notes here. When he clicks, he will be able to see all the admission notes that are done for that patient, and the lab investigation that are sent, the medication chart, everything. We have the images here, the x-ray images. We have the consent images here if there are any. This is where you'll be able to see them. So for now, this is a new patient, so we are not expecting to see anything for this patient. So this is just the visit that is sent for this patient. So we are going to click on document clinic notes. Right, so once this patient comes with the doctor, maybe there are two types of consulting the patient. Maybe there are two types of way that the patient can be consulted. If the patient is a remote patient, maybe the patient is not within the premises of the hospital, you can an email can be sent to the patient with the link that he can join a video call with the doctor. And from there, the doctor can be able to see the patient and make documentation for the patient, send live investigation, and prescribe drugs for the patient. This is one of the advantages of using an EHR software in a clinic. So for this one, this is where he can document the clinical note of the patient. When he click here, it will give him the button where he will be typing all the clinical data for that patient. Maybe patient sim. You can update the clinical note of this patient. So once that is done, then you can send live investigation for this patient. Once that is done, you can send an investigation for the patient to laboratory. Once you click there, it will bring you these investigations with their prices, and from there you can search for an investigation, maybe LFT. You'll see the price of LFT. You can send 5 at a time. We have HBV combo, or maybe we have full fasting blood. We have fasting blood sugar, and what have you. You can select as many as 5 at a time. Then send the investigations. Once they are sent, and from there, then I think. The drugs, yeah, exactly, the drugs, that's what is remain. We can see here we have the clinical that is written for this patient. We have the investigations here it is telling us that the investigation are not ready, the results. So once the result is uploaded from the laboratory, the doctor will be able to see all the investigations from his system. He doesn't need to wait for the laboratory to bring him the results. Once they upload the results, he will be able to see the investigation, so there's no need for printing all the results. And from here, we can send the results to the patients if they are, maybe they want the results directly sent to them. Okay, so we have this is where you can prescribe the drugs for this patient. Once you click here, it will give you the prescription page. This is it. Then we have all the drugs here. You can select from as many as you want. We have this, let's say antidiabetic. You put the dose of this drug, maybe 3 over 12, lasts for 3 weeks, 3 months. Sorry. Then we have this 1 over 52, maybe BD. That's it. You put all the drugs that you want the patients to take, then you add drug. So these drugs will be sent to the pharmacy. From the pharmacy there, they will be able to see all the drugs that are sent for a patient. We can see the drugs here on that drugs. We can see them here. And when we come back to the dashboard, the home page of the software at the pharmacy, when we come here and put the EHR number of this patient under the dashboard of the pharmacy, we'll be able to see all the drugs that are sent from the doctor's desk for this private patient. We have this anti-diabetic. So this is where the pharmacy. So this is where the pharmacies will be able to see all the drugs that are sent for a patient. And from here they can set the quantity that they have from the stock. Already the quantity is set in the stock. So the software will fetch all the available quantity and let them select the quantity that they are giving a patient. Maybe if they are giving this 2 and this one they are giving maybe 2, then it will automatically make the calculation for them that this is the amount they are paying for this drug. You understand? And you can select how maybe if you have this only type ciprofloxacin and maybe you don't have anti-diabetic, then you just select the quantity, the one that you have, you put the quantity, then it will just send the amount to the cashier for this one drug that you sent. So you click on bill drugs and it will bill the patient and send the drugs to the cashier. So we have this drug that we do not bill and this one we bill it here. So when we go back to the cash office, we'll be able to see the drug that is sent from the we have the drug here, ciprofloxacin, and the investigation. So we don't need to go there. We just start with the well, let's just add them all. Okay, so we have this cash and it will give us the total amount that the patient is supposed to pay. So now when we come back here, we'll be able to see that the patient has paid for this drug because it comes under paid prescription. So we can select and click on dispense and then give the patient the drug. This drug, the quantity of the drug has been deducted from the total quantity that we have in the stock. So the quantity is reduced by the number of quantity we selected here, that is 2. So that means our stock will be reducing based on the quantity we've sold to the patients. And the laboratory as well is the same process with the pharmacy. You put the EHR number, you select the investigations for the patient, and it will show you all the investigations that are paid for. These are the investigations we have made payment of, LFT and HB combo. Then you click on update result. Then you have all the forms that you need for the investigation. So when you click, you see the results. You will see the investigation form and fill it up. So that's how it works. So I think we have so many things here in the software. And we have administration where we can manage the software. We can do so many things in the administration. We have the report of the wallet, maybe wallet for the family cards, retainership cards. We have retainership. We have NHIS reports, HMO reports, the reports of every HMO for a day, maybe month, or what have you. So you can select as many as you want. We have inpatient, admitted patient, that's admitted patient, where you'll be able to see all the patients that are on admission, and you can do all the medication charts from the software. So everything is covered in the software. I think what you need to do, if you are interested in the software, you can just go through the link that I will provide to you, and from there you'll be able to go through the software. If you have any question regarding the software, you can just reach me out on the email that I provided, or maybe the contact I sent, I gave you. We are happy to have any time to automate all the clinics in the country. And I think for the remote video call, we have not done that. When you click here, it will give you the interfaces, two interfaces. That's your interface and the remote interface of the patient. So when you click on start call, it will initiate the call, and the patient there will just click on accept the call. Then it will just give you the image of the patient from there. So that is sorry. So it will give you the image of the patient once you click on initiate call, and it will start. You can start the consultation and do all the write-ups that you want from here. Right, thanks for watching. As you have seen, MidHealth is a reliable, easy-to-use solution that can help modernize your healthcare practice. If you are interested in getting MidHealth for your clinic or want a free demo, feel free to reach out. My contact details are in the description below. Maybe if I send you this video directly, I will send you with my contact details. And don't forget to like, share, subscribe for more smart digital tools that I made. Thanks for watching. As you have seen, MidHealth is a reliable, easy-to-use solution that can help modernize your healthcare practice. If you are interested in getting MidHealth for your clinic or want a free demo, feel free to reach out. My contact details are in the description below. Don't forget to like, share, and subscribe for more smart digital tools that made simple. Thank you.